have to use the bathroom.
So what if I told you that there's a direct correlation between how often you go to the bathroom, how hard that is, how terrible that experience is, how many times you're getting up to go to urinate at night, how often you're rushing to the bathroom and not making it, maybe even dribbling? What if I told you that there's a direct correlation between those intense lower urinary tract symptoms and erectile dysfunction? As a matter of fact, a recent study found that there is almost a 90% correlation between guys who have an enlarged prostate with lower urinary tract symptoms and erectile dysfunction. So urinary symptoms are risk factors for ED independently, just like other recognized ones like age, diabetes, metabolic syndrome, hypertension, pelvic surgery, all of which are associated with erectile dysfunction. And the severity of, like, the weak urine stream, straining to push it out, going very often, and even getting up plenty of times during the night, the severity of those symptoms correlates directly with how bad the ED can be. So what I'm going to do today is take you through this process of 5 lifestyle ways, not medication ways, that you can actually cut down on these symptoms and potentially improve your experience with your urinary tract and avoid some of these symptoms, but also maybe even boost the quality of your erections. All right, so let's just get straight to it. So I'm going to go through my system of what I call total prostate care. So we've got lifestyle changes that we're going to discuss, bladder irritants, double voiding, urethral milking, yes, there's a thing, and the top supplements that are used clinically to help strengthen and heal the prostate. Now, we know you've got things to do and places to go, but one problem that I see is that a lot of times you're not going to the bathroom as quickly as you should. First of all, you want to go the minute it hits. Now, when it comes to lifestyle changes, the top lifestyle change is that you need to poop every single day. Yes. When poop is stuck in the rectum, it actually is applying pressure on the prostatic urethra, the part of the urethra that goes to the prostate. And what it does is it makes complete emptying of the bladder an issue. So consider adding a probiotic to your daily regimen and even trying some of my smoothie recipes to increase the possibility that you are going to poop every single day, every day, not every other day, but every day. Also, even adding omega-3 fatty acids to your current supplement list. All of that can help us poop every day, which becomes important when it comes to reducing these urinary symptoms. Now, the next thing I want you to encourage you to do, this one's going to sound counterproductive, right? Is that you've got to start drinking a bunch of water every day. I'm not going to tell you how much, but water not only keeps you hydrated and healthy and helps improve everything, but it also decreases bladder irritation. Now, speaking of bladder irritations, the next thing that I want you to do is we're going to talk about bladder irritants. Now, bladder irritants are one of my favorite things to talk about because doctors, when they put you on overactive bladder medications or even talk to you about your prostate, they really don't mention much about bladder irritants. Now, these bladder irritants will irritate your bladder and they will irritate my bladder, because that's what they do based off of the anatomy. So these aren't just going to be specific for gentlemen. These bladder irritants can be irritants to women and or men. And what you'll do is, as we go through them and you start to hear them and you're shocked and you're in awe, I want you to consider this is how we do things. We call it an elimination diet. Because just because it's a bladder irritant doesn't mean it's going to irritate your bladder. So in order to reduce the urge to urinate all the time, here are a list of food products and things that you want to start thinking about avoiding or minimizing. But really the key comes in to next week, I want you to stop all of the ones that I mentioned completely for about a week or so. See how the symptoms improve. Then I want you to, one by one, every 4 days, introduce one of those things I told you to stop doing back into your diet. Now I want you to see if your bladder becomes irritated because of it. Wait 4 days and then try to add something else. What this does is allows you to decide what irritates your bladder and what doesn't. And then it gives you a clinical state of reference, right? Because just because I say it doesn't mean you're going to believe it. And just because I say it doesn't necessarily mean it's true, because we're all different. We're all created by God and we're all created differently. So just because it's a bladder irritant doesn't necessarily mean it's going to irritate your bladder, but let's go through them. 1, smoking. Smoking, the nicotine irritates your bladder. 2, researchers in Massachusetts found that a man that drank an average of 2 cups of coffee a day were more likely to develop lower urinary tract symptoms and difficulty with urine storage, while women actually develop progressively worse symptoms of urging and having to rush to the bathroom. So caffeine in the energy drinks and in the coffee, maybe go for decaf or even a low acid coffee. Very dark roasts are naturally low in acid as well, so you've got options. Next is beer, alcohol, and wine. All right, so one thing, the high tannin wines are the problem. So look for a low tannin wine like Merlot or Pinot Noir. Rum, vodka, and gin may be the easiest on the bladder. Beer, because carbonated drinks irritate the bladder. I'm telling you, even if you have a propensity to want to drink that carbonated water, you know, that's my thing, I like to grab it, you'll notice that can irritate your bladder too, all right? Now, the next one is artificial sweeteners. Now, if you follow me, you know I tell you don't do those things anyway. But artificial sweeteners in drinks and in diet gum can actually irritate the bladder. Yes, believe it or not, one more reason to not use them. So they appear to be bladder irritating, particularly aspartame. And that's like the NutraSweet. But most diet products that say sugar-free or 1 calorie, iced tea or soda, should in fact be avoided because they irritate the bladder. Another thing are acidic fruits. Some of my favorites, lemon, pineapple, oranges, apples. So opt for blueberries, strawberries, pears, honeydew melon. Those are really low acid fruit and they won't irritate as much. And then unfortunately, some nuts. Yes, like cashews. So maybe try some of the seeds. And if you follow me, you know, and then we did a whole video on it, that pumpkin seeds are particularly very helpful for prostate symptoms and prostate health. So maybe just switch over from some of the nuts that may be causing a problem to pumpkin seeds, which aren't even associated with bladder irritation. But like I said, try your nuts, try without nuts, then start adding different nuts back in and see which ones seem to be irritating you. And if none of them irritate you, hallelujah, proceed. All right. Now, the next thing I want you to think about are high histamine containing foods. So why is histamine even an issue? Well, the bladder, and in people who have really irritated bladders or even interstitial cystitis, actually, when we look at the bladder, they have a high number of mast cells. So mast cells are an important part of the biology of your bladder. And histamine containing foods or things that cause a release in histamine can in fact irritate the bladder. So what you want to do is really do your best at avoiding high histamine containing foods if you're having any issues, like red wine, chocolate, fermented foods even, processed meats like the deli meats and sausages and bacons. There are mast cells in the bladder that will release histamine if you're taking in high levels of histamine-related foods. Even estrogen stimulates the release of histamine, so that's something to keep in mind for ladies. So making sure that you keep your diet low in histamine-containing products helps. Next, aged cheese. I know, don't strangle me. Aged cheese is so good, right? But what you want to do is start trying to avoid aged cheddar cheese and opt for more like milder cheeses like the mozzarella and the ricotta and feta even. They're gentler on the bladder, but I want to warn you that for some people it's the dairy that's causing problems irritating the bladder, because To some people, dairy causes inflammation in their body, and that might be what's actually causing the irritation in your bladder and causing you to have some of these symptoms that we're talking about. So, if you want to have less urinary tract symptoms, you want to go through these lists and really start trying to figure out what can you eliminate, what can you minimize, and then see if your bladder starts to feel better. If you're peeing less, but peeing less at night, having less times where you're rushing or going so many times, less residual urine, all these things, after they improve, then you start to slowly reintroduce these products and see which one, if any, was the culprit, right? And then, of course, vitamin C and B. We take these things. Vitamin C does help boost our immune system, but it actually irritates the bladder too. So even think about that with your supplements. Now let's talk about double voiding. So double voiding is where you make the effort to pee more than once in that same setting. And each time that you go to the bathroom, sometimes you're in a rush, you just go, you pee, and you rush out, right? You're not giving your body an adequate amount of time to urinate. And then that leads to leaks. So let's think about it in terms of when we get to the bathroom, we want to be very productive, right? So double voiding is something doctors do sometimes talk about, but what's frustrating to me is that they don't really teach you the proper way to go about doing that. So I'm going to go through that in a little bit. But I want you to understand that in order to improve some of these symptoms, you might have to change the way that you're doing the things. Now, when I tell you that we're going to have better results if you actually sit and do this, then you're going to just have to think about it. Sometimes it's okay to sit on the toilet for guys, right? In some cultures, that's really just how they do it. So I want you to keep that in mind as we go through the process of how to double void. All right, as I go through the process of how to do your urethral milking. Now, the male urethra is about 18 to 20 centimeters long on average, and it's shaped like an S. It's shaped like an S and not straight all the way, right? So what I want you to do when you're keeping this in mind, how the anatomy actually looks, then you'll understand how the finish is so important. So instead of finishing and just kind of finishing and shaking it off and leaving, or washing your hands first, of course, you are going to sit down and relax, right? And when you sit down and relax your muscles, I want you to attempt to void again, right? Just kind of relax, put your stomach out a little bit and just kind of sink into it and just relax. Straight upper back, but I want you to, after you're voiding, take a minute. You can run some water. You can do a lot of different things. And I'm going to bring my friend out. Don't judge us because we did move across the country and he's a little dusty. But what we're going to do is this area right here. I want you to reach around while you're sitting on the toilet. You're going to reach around and you're going to apply perineal pressure right here. So you're actually going to take your finger and you're going to stroke forward with it, almost like you're milking it. You're pushing and gliding. So it's a motion of like pushing down and gliding forward. And what that's doing is it's milking the urine towards the part of the urethra that may not have a problem. So then once you milk it forward, and you should feel it, you should actually feel a little pressure on your bladder, you can actually feel it moving, then you're going to want to finish out and milk it all the way through. Squeeze and milk, squeeze and milk. This is not a masturbation type of technique. And then when it gets to the tip, you're going to squeeze it and drop off the residual urine. This is called urethral milking. You cannot go wrong if you start urethral milking. It'll help decrease the dribbling. It'll help make it so that you are completely emptying your bladder each time so you don't have to rush so much. And it will clear the way for your pelvic floor to have more space to get the blood flow to where we want it to go, which is our erection, right? So urethral milking is a very important part of improving your lower urinary tract symptoms, particularly if you have an enlarged prostate. All right? I hope that one helps. That's a really, really great one. Now, So we talked about urethral milking. Let's also talk about the proper way to do your second round, your double voiding. So first what I want you to do is you feel the urge, don't wait. Then I want you to go to the bathroom and sit down. Relax your abdominal muscles, because when you do that, it actually allows you to relax your pelvic floor. You're going to sit with your knees and legs wide apart, and you're going to lean forward slightly, keeping your back as straight as possible. Turn on the warm water, and then I want you to just tap. Tap right on your lower abdomen, right below your belly button, right above your pubic hair. You're just gonna tap, do a couple of these, tap for it. Pooch it out all the way. Your tummy's pooched out and you're tapping on it. And then I want you to try again. Now, what we're going to do when we try again is you're gonna actually bear down. You're gonna bear down and you are going to kind of almost put the pressure at the base, like you've got to go again and push it out. This double voiding is much easier in a seated position than it will ever be with you standing in front of the urinal or standing up. And then, here's the good part. If you're sitting down on the toilet and you have a partner that's coming behind you, they're not going to get mad at you for leaving the seat up because you didn't, you sat. Awesome? So we got to always see the bright side. Now, the other thing I want you to keep in mind that is that in Germany and Austria, one of the first lines of treatment for prostate enlargement, or BPH, or some of these lower urinary tract symptoms that we're talking about, is herbal-based, is plant-based. They don't go directly to the prescription medications. They go to supplements first. So what I want to do now is list them for you. Now, as you know, with my series, as I'm going through talking about prostate function and herbal products, I'm going through each of these one by one. So you want to reference some of my other videos on prostate care, but let's go through and talk about some of these. So one is saw palmetto. You'll see it on the box as Serona repens, right? Then there's stinging nettle, Pygeum africanum, pumpkin seeds extract, ryegrass pollen or seniltin, soy isoflavones, and beta cytosterol. Those are all some of the top supplements that we see in formulations that are designed specifically for BPH and for prostate support. So we've gone through all of these different things that you can keep in mind, that you can try in order to get control of your lower urinary tract symptoms, which includes rushing to the bathroom, dribbling after you go to the bathroom, going to the bathroom so many times, getting up at night often to use it, and maybe even a little pain when you urinate. All of those symptoms are independently associated with erectile dysfunction. So let's get those symptoms under control so we have less dysfunction and more complete function. So I'm Dr. Rachel, a functional medicine physician with a focus on men's health, and this is what we do here. We talk about healthy ways to support you and optimize without necessarily having to go to a prescription medication. All right. So if you want to learn more about our Ultimate Stiffness Prostate Bundle, the link is listed below. And